Hello and welcome to today's session. My name is Catalina Ujay Gomez and I work in the Department of Primary Care and Mental Health at the University of Liverpool. I'm a postdoctoral research associate and I work with the Applied Research Collaboration Northwest Coast, and within that I'm a member of the MIDAS cross-cutting team that stands for Methodological Innovation, Development, Adaptation and Support. In MIDAS, we provide methodological support to health and social care professionals who are interested in conducting applied research. In today's session, I'm going to talk about evaluating intervention integrity through reviewing the process evaluation of studies included in systematic reviews. So I prepared this session with the assumption that you have done or at least come across systematic reviews before. So I'll just give a quick definition of systematic reviews and what type of analyses can be included. Then we'll go on to talking about what process evaluation is and why it's useful, what is intervention integrity and how we measure it, and finally how to analyze process evaluation and what difference it could make to your conclusion. So just a quick reminder about what a systematic review is. So a systematic review attempts to identify, appraise and synthesize all of the empirical evidence that meets pre-specified eligibility criteria to answer a specific research question. Researchers who conduct systematic reviews use explicit systematic methods that are selected with a view aimed at minimizing bias to produce more reliable findings to inform decision making. So a systematic review can consist of a number of different elements, and it can include a meta-analysis which is considered to provide the most robust findings. So it's basically an analysis of quantitative information, given that the studies report all the appropriate data that is needed for a meta-analysis, which is unfortunately not always the case. And that's given that heterogeneity are not high, which would mean that the studies are very different and would be difficult to compare. Then we have the option of synthesizing narrative data in the case of qualitative studies, or if appropriate data for meta-analysis is not available in quantitative studies. Through an economic evaluation, we can determine the cost effectiveness of the reviewed studies. And finally, we can conduct an evaluation of intervention integrity to complement meta-analysis, thematic synthesis, and economic evaluation, which can be done through reviewing the integral process evaluation of the studies. And again, hopefully these are available. So it's this element of the systematic reviews that we are going to focus on today. So process evaluation is an essential part of designing and testing complex interventions, and the updated guidance of the Medical Research Council now recognizes its value within trials and recommends their use, and this can be done to assess fidelity and quality of implementation, to clarify causal mechanisms, and also to identify contextual factors that are associated with differences in outcomes. So process evaluation enables a deeper understanding of potential challenges and solutions to aid the implementation of effective interventions. So what it can do is it can provide insight into the causal mechanisms of complex interventions, to the contextual factors, and inform as to whether an intervention is effective due to implementation failure or failure of the intervention itself. So they provide findings that are valuable in determining whether a complex intervention should be scaled up or modified for other contexts. And it can help to explain for whom, how, and why a complex intervention had a particular impact, and why we can see inconsistency in the findings, why the lack of significant findings, and what might be the factor that impacted on the effectiveness or the ineffectiveness of a particular intervention. So why bother with reviewing process evaluation? What if your meta-analysis of RCTs find that, statistically speaking, the intervention did not make a difference? And even if you find statistically significant intervention effect sizes do not provide policymakers with information on how an intervention might be replicated in their specific context or whether trial outcomes will be reproduced. So what if your meta-analysis finds inconsistency? So some studies find interventions effective, others didn't, or we are finding that the interventions may be effective overall, but they're showing a large confidence intervals, which means that we have a wide range of effects. So does the lack of statistical significance mean that the intervention is useless? And you conclude that these interventions delivered in the past, I don't know how many years, like 20 years, for example, were not effective and therefore should not be used at all. Would this be useful for practice? So what you can do instead is dig deeper and review the process evaluation that RCTs should include to put things into context and demonstrate intervention integrity. And this will provide qualitative data, which can then be synthesized using either thematic analysis or content analysis, depending on how much data you have. So an issue that arises when we are reviewing public health and health promotion interventions is that complexity and how we can disentangle intervention effects from the influence of the context and the wider system in which that intervention was implemented. So to do this, we have to seek information on contextual factors and on the characteristics of the interventions, because these could explain then to what extent the intervention or the outcomes were sustained. In other words, we have to look at the integrity of interventions. So using the definition of the Cochrane Library, intervention integrity is the degree to which specified procedures or components of the interventions are implemented, because these can have important consequences for the findings from a study, with the potential to impact the presence or the magnitude of the effect, and can help assess applicability, which is an important issue in practice. So for complex interventions, for example, the ones that evaluate psychotherapy or behavior and educational approaches or healthcare delivery strategies, it's important to collect information about the contents of the intervention, also who delivered it, and the format and timing of delivery as well. The integrity of an intervention may be monitored and evaluated using process measures, and feedback from such an evaluation may lead to evolution of the intervention itself. And process evaluations can provide us with a useful source of factors that potentially influence the effectiveness of an intervention. So for example, in a Cochrane review that evaluated intervention integrity on smoking cessation in pregnancy, well, first of all, they found that process evaluation of the intervention was only carried out in some trials, unfortunately. But importantly, the review highlighted how transferring an intervention from one setting to another may reduce its effectiveness if components are changed or some aspects of the intervention are culturally inappropriate, for example. So to provide an example that can illustrate the benefits of reviewing process evaluation, I'll introduce a comprehensive systematic review that I conducted that aimed to review the evidence of psychosocial interventions to reduce maternal alcohol consumption. 24 studies were included. 24 studies were eligible for inclusion. Literature search included the search of multiple databases, namely PsycInfo, PubMed, and Scopus. Participants were pregnant women and mothers with dependent children. And we were looking for an outcome of reduction of alcohol use in mothers and abstinence in pregnant women. Our review included a narrative synthesis to summarize the findings of the studies with a subset of trials that were eligible for a random effects meta-analysis, in addition to, obviously, an evaluation of intervention integrity through synthesizing information obtained from integral process evaluation of studies. And finally, general and alcohol-specific behavior change techniques were also identified to investigate potential mechanism of change. So we included 20 trials on alcohol-related pregnancy interventions. Abstinence data were available for only 6 trials out of the 20, investigating the effects of alcohol reduction interventions versus on abstinence during pregnancy. The odds of achieving abstinence were 2.31 times higher in the intervention groups compared with the control groups. So the question is, can we conclude that these interventions are effective? So some food for thought: only 6 out of 20 studies had data available for meta-analysis. So is this enough evidence? Now, four RCTs investigated the effectiveness of an alcohol reduction intervention on decreasing consumption in motherhood. The test of overall effect revealed a small but statistically and clinically significant difference in favor of the intervention groups. Only 4 studies could be included in this area, however, and surprisingly, no more studies on interventions in the area of alcohol reduction in motherhood was available. So is that sufficient evidence to conclude anything? So for the remaining 14 studies that could not be included in the meta-analysis, provided inconsistent findings through narrative synthesis in terms of intervention effectiveness in pregnant women. Only 2 of these studies found significant differences in favor of the intervention. 3 trials revealed some beneficial intervention effect. So, for example, benefits were seen in heavier drinking participants. 4 other studies used a variety of different interventions, such as home visits by paraprofessionals. These are basically mentor mothers. And RCTs that were over 20 years old used a variety of intervention types, such as professional home visits to provide health education, high versus low feedback ultrasound, and written information coupled with physician advice and video. So these interventions were all very different, therefore difficult to compare, and none of them found really a significant effect on drinking during pregnancy. So we used inductive content analysis to synthesize data obtained from process evaluation of trials, and identified 5 different categories that reflected factors that may have impacted the effectiveness on the interventions, and which led to conflicting findings and that were mentioned previously. So the findings revealed that the level of alcohol risk and consumption varied amongst studies. Motivational approaches and brief interventions were best with heavy drinkers who do not necessarily satisfy criteria for dependence, and also low levels of alcohol use or high rates of abstinence at baseline leave little room to demonstrate intervention effect really. Now, low consumption level may be due to the strong motivating effect of pregnancy to change these health-related behaviors, and the fact that motivated women are more likely to participate in an intervention. So motivational interviewing may be most effective with people who are less motivated, more resistant to change, and who are not ready to set goals. So readiness to change is an important factor to consider. 6 of the 10 studies used single session motivational interviewing or brief interventions, and 4 tested multiple sessions. So although single session interventions can be effective in heavy drinkers, there's no clear evidence really that's specific to pregnant women. So indeed, multiple sessions may be more effective, especially for lower drinking population, due to the repetition of the message. So it is well established that self-reported alcohol use can be misleading, and especially in heavy drinking populations. In maternal groups, underreporting may be driven by social desirability bias, which is basically wanting to look good, or recall bias, or they don't remember exactly how much they drank, mistrust within clinical settings, and fear of consequences. So for example, fear of losing custody of the child. So self-report measures may not be adequate to identify those needing interventions and or the effectiveness of interventions, or measuring the effectiveness of interventions. And finally, 8 studies found reduction in drinking irrespective of condition. So women in control groups may have reduced their drinking due to the assessment alone or recognition of pregnancy. And if intervention provision and other study processes involve the same professional provider, qualities and learned behaviors may cross over the 2 conditions. So contamination of intervention is also another important factor to consider. So it's important to mention that guided by the available data, we did a content analysis here. However, if sufficient data is available in process evaluations, thematic synthesis can also be used, which would provide a more thorough and even more rigorous analysis of the process evaluation data. An example for this is the O'Mara Eves et al. Study or paper that was published in 2013, which is also openly available, and I added the reference in the reference list. And it's a very useful, although a long-winded report to read. So, in conclusion, while the meta-analysis demonstrated intervention effectiveness, both the number of studies included in the pooled effect sizes were very small, and the interventions varied in terms of population type and intervention approach. Now, the data summarized in the narrative synthesis don't provide sufficient evidence to determine the effectiveness of pregnancy-specific alcohol interventions, as findings were inconsistent. So, therefore, it was not possible to draw a definite conclusion based on the evidence provided by the meta-analysis and the narrative synthesis with regard to alcohol reduction interventions for pregnancy and motherhood. However, through evaluating intervention integrity, we revealed that a variety of intervention used, the variety used in differences in drinking levels, frequency of intervention sessions, and population diversity are all factors that can influence whether or not an intervention will be actually effective. So this way we can inform intervention development, clinical decision, and further research about what factors need to be considered when choosing an intervention. So it's not always necessarily a black and white answer whether an intervention is effective or not. So in summary, we perform systematic reviews to produce more reliable findings and to inform decision making. And in order to do this, it is best to consider all available data, so quantitative, qualitative, economic data, as well as process evaluation that demonstrates context, mechanisms and processes to draw conclusions about what works, why, and for whom. So I've included a couple of reference slides which also provide useful reading and learning material. And if you have any questions whatsoever about this presentation or the content, please feel free to contact me by email or on Twitter. So thank you very much for your attention and have a great day.